this is the hip bone or the coxal bone, and this big socket here is the acetabulum. Acetabulum, where the head of the femur will articulate. Then we have this bone like ilium. Ilium is the largest bone. Then from here, actually, from here to here, we have the ischium, and this one here to here is the pubis bone. Then we have anterior superior iliac spine on this side, and the posterior superior iliac spine on this side. This is known as iliac crest. The ridge is the iliac crest, and this shallow fossa is known as iliac fossa because it is in the ilium. This big notch here is known as the greater sciatic notch, through which the sciatic nerve will pass. This spine here is known as the ischial spine, and below the ischial spine we have the lesser sciatic notch. This is the greater sciatic notch, ischial spine, lesser sciatic notch. Then this rough surface in the ischium is known as ischial tuberosity. So when we are sitting, we are putting the weight here on the ischial tuberosity. This hole here is known as the obturator foramen, and this bone here is the pubic bone, and the pubic bone will articulate with another pelvic bone with the pubic symphysis. Here, this rough surface here will form the sacroiliac joint with the sacrum. So I will go one more time. This ridge here is the iliac crest. This is the shallow fossa, is the iliac fossa. Anterior superior iliac spine, posterior superior iliac spine, greater sciatic notch, ischial spine, lesser sciatic notch, ischial tuberosity, obturator foramen, pubic bone, and acetabulum. Now we will look at the femur. Femur is the longest and thickest bone in the body. Head of the femur has this pit known as fovea capitis. So this pit, a ligament attaches the head of the femur, and that ligament attaches into this pit, and it attaches the head of the femur with the acetabulum. Provides stability. These big projections, this is the greater trochanter and this is the lesser trochanter. These are for muscle attachment. This narrow part here is the neck of the femur, this one. Now, this line which is going down is the actually linea aspera. Now, like head is always on the medial side, so we go towards the head side. This is the medial condyle towards the head side. Opposite, like towards the greater trochanter, this is the lateral condyle. Then epicondyle on the outer side. So medial epicondyle and lateral epicondyle. So this is the femur. Head of the femur, fovea capitis, neck of the femur, greater trochanter, lesser trochanter, linea aspera, medial condyle of femur, lateral condyle of the femur, medial epicondyle of femur, and lateral epicondyle of femur. Like that. Now we will look at tibia. So below the knee we have two bones in the leg, tibia and fibula. So this is tibia. Now, on the tibia, this bump here is known as tibial tuberosity, and this line going down here, this is known as anterior crest. Then we have, this is the medial malleolus, and medial malleolus, we can feel it on the medial side of the ankle. If we palpate it, we will feel a round projection. That is this one, medial malleolus. So if we go medial malleolus straight up, here is the medial condyle, and this surface here where the medial condyle of the femur will articulate. So this side we have the lateral condyle, and this is the articular surface where the lateral condyle of the femur will articulate. So medial condyle, lateral condyle, tibial tuberosity, anterior crest, and medial malleolus. That is tibia. Now we will look at fibula. So this is fibula, and this is located on the lateral side. In the fibula, this is the head of the fibula. This one, like looks like a triangle shape. That is the head of the fibula. And here is the lateral malleolus. Lateral malleolus look like a spine, like blunt spine. And we can feel even the lateral malleolus when we palpate on the lateral side. So that is fibula. And then we will look at this one. In this one, actually, this is the heel bone, which is calcaneus, and this is talus. Above the calcaneus, this is the cuboid, and above the talus, this one is the navicular. Now, see, this is the big toe. So this one above the navicular, this one is the medial cuneiform, this is the intermediate cuneiform, and this is the lateral cuneiform. Calcaneus and talus can be the separate bones, like we can put only one calcaneus and we can have one talus, and they are in the back. So calcaneus, talus, cuboid, navicular, medial cuneiform, intermediate cuneiform, and the lateral cuneiform. These are the metatarsals, and then these are the phalanges. Big toe has proximal phalange and distal phalange, no medial phalange, whereas the other fingers have proximal, middle, and distal phalange. Proximal, middle, and distal phalange, like that. So now we are done with the pelvic girdle.